How does he know generate?
A'udhu billahi minash shaitanir rajeem. Bismillahir rahmanir rahim. Dr. Daliai, the members of the External Evaluation Commission, my respected Professor Javed Akram, Minister Health, Mr. Ali Jan, my Secretary Primary and Secondary Health, Wajid Shah Saab, Special Secretary Health, Dr. Ilyas Gondal, Director General Health, Dr. Salman, Head of the Infectious Disease, I think, from National Institute of Health, and Dr. Rizwan, who is really a dynamic man. I must introduce him. The revolution of ambulance service which took place in Pakistan, especially in Punjab, the credit goes to Dr. Rizwan. And in addition to this ambulance service, credit also goes to my secretary, Mr. Ali Jan, who recently given 300 ambulances, and all other ambulances which he has before were donated to 11, 22, and it was a revolutionary decision in my opinion. Previous days, he has given 300 ultrasound machine and 200 ambulances to provide the medical facilities, especially at the basic health unit level and rural health center. These are those areas which are neglected and our department is trying to give maximum facilities to those section, because if we improve the facilities at the primary and secondary health level, as Professor Javed Akram said, we will be able to lessen the load on these tertiary hospitals. First of all, I am thankful to Dr. Dalia. I'm sorry, I was trying to recall, but unfortunately, always it is Dr. Dalia. And she explained in a very beautiful and what should I say, that in such a manner that everybody was listening what are the rules and regulation of this external evaluation commission, what are the coloring of the code and how the G works and how the implement and how we can mutually work together. My humble suggestion is that when you are going to compile the report on external evaluation, you should also mention province-wise report, so that we should be at least able to understand that which province is working better than the other province. This will encourage that province, and we will be happy when we will be rewarded by your comments that Punjab, because I believe our health department of the Punjab is working better than any other province, and we are trying to improve our health facilities. So this is my request, that you should also mention, so that the provinces which are weaker, we will concentrate those provinces there. So as our Ali Jan Saab has given you a detailed description, and I totally agree that we should also see the problems and priority of the health system. He is right, especially the pharmaceutical industry, food authority, and I would believe with his suggestion that though it is a very difficult suggestion, but still I second him that the pharma industry should have been regulated by the WHO, at least Pakistan, with draft system, so that quality of the medicine should improve. And these antimicrobial resistance which is occurring, it is not because of only the misuse of the drug, it is also because of the low quality of the drug as well. And as my my secretary said, that unfortunately we have medical superintendents, they are not sharp. It is because of the political system. I believe whenever there is a political system, I am not against political system, but mostly the medical superintendent nominated or given charges to the different hospital, they are those people who have good relationship with the politician, not on the merit. I must say this. And all those doctors and administrators who fulfill the requirement and who are married or on merit, but they have no relation with our politician, they are not appointed on the medical hospitals. Therefore, I believe it is our leadership who is responsible for the bad governance in every province of Pakistan. So therefore, whenever you are giving donation to us, please ensure that merit should be followed on the appointment of the key post. Another issue which can take place is the that we should work on the prevention of the diseases. As you said, Dr. Dalia said that we should work on the prevention of the diseases. For example, I organized I organized an NGO with the name of Pakistan Green Task Force in 1998 with the slogan that make the country green and make the country clean. And at that time, I worked for the betterment of the environment and the betterment of the water supply, because I believe at that time 80% of the diseases in Pakistan are spread by the contaminated water. If we can supply pure water to these people, 80%, if we will be able to at least save 40%, we can prevent the diseases. So the burden of the drugs, burden on the laboratory, burden on the hospital can be reduced just by supplying the good water supply. At that time, I also raised the slogan that make the environment clean. At that time, people said you are a mad person. When I started this revolutionary thing that make the country green and clean, make the environment good and make the water supply good, I planted at those time from that to onward zero point 0.8 billion trees in Rawalpindi, Islamabad. And because of that commitment, I was awarded Pride of Performance by the President of Pakistan and also awarded the Medal of Merit by President of Pakistan, Asif Ali Zardari. I have got 2 merit because of this. So I believe that we should work on the prevention of the disease so that our maximum load and maximum expenditure should be reduced. I want to say a lot of things, but Dr. Yadullah's presentation was excellent. Lot have been said, and in the end, I would say that whenever you will give up your final notes in the end, please tell us our weaknesses, because we will try to improve. We will try to see those weaknesses. We will analyze the weaknesses, and we will try to divert our fund from the Punjab government, at least because I am the representative of the Punjab, along with the fund which you will give to the from the donors, to fulfill or to improve those weaknesses, so that in future when you come again, inshallah, I believe with this leadership we will be able to solve those problems. In the end, I must say prevention is better than cure. Thank you very much.